you in person in Miami, but we hope that the platform we've selected will still encourage a lot of great discussions amongst our thoracic surgery colleagues. So my name is Yihan Lin. I'm the TSRA Vice President, and I'm going to give you a brief overview of tonight's events. We're going to start off with the presidential address by Claudine Lewis. We'll then move on to the award ceremony for our teaching awards as well as our travel fellowships. And then Claudine will give a brief overview of the TSRA activities for the After that, we'll move on to the networking portion of this event, where we will use the Remo platform to have everybody sit at different tables and interact with all of your thoracic surgery colleagues. So let me just introduce our president of the TSRA this year, Dr. Claudine Lewis. He is a graduating I6 fellow at the University of Rochester, and he's also going to be doing an endovascular cardiac surgery and structural heart fellowship at Brigham and Women's Hospital later this year. So without further ado, Claudine Lewis.
Greetings, I'm Claudine Lewis, a PGY6 resident at the University of Rochester. I have the privilege of being the 24th TSRA president this year, and this is the third annual TSRA presidential address. I truthfully believe that a non-traditional mindset is essential to attracting and creating innovation in cardiothoracic surgery. Over the past 2 years, humanity has faced an arch nemesis, the likes of which has not been seen or witnessed greater than 100 years. It is one that has made time stand still for this country, bringing the world to a grinding halt. Through it all, the Thoracic Surgery Resident Association has remained steadfast in its mission and in the trenches of thoracic surgery education. 2 years ago, Dr. Xiaoying Liu wrote the inaugural TSRA presidential address regarding passion for our field. And during the leadership of Dr. Brescia last year, an entirely new virtual world, we introduced bi-weekly podcasts with serial experts on a multitude of topics on our favorite Zoom platform. This year, I bring you the concept of diversity on innovation and the acceptance of the non-traditional. This concept, I hope, infuses all aspects of our work, be it in educational paradigms and training, clinical innovations drawn from new perspectives, and in representation at the table. Diversity is king. Diversity of thought led pioneers in cardiac surgery to operate on the heart when such a task was told to be impossible. A similar mindset led to cardiopulmonary bypass, as well as key breakthroughs in congenital heart surgery. Diversity in representation has been essential, and more than ever has led to a lot of changes, as has been seen by the works of women in thoracic surgery. Most recently, we diversified paradigms of training and novel modalities of clinical education, as seen by the integrated thoracic surgery experiment in regards to the new training methods. And we see that that is coming out to be a alternative pathway for training our field. Whether it be by collaboration among institutions or pooling of educational resources, diverse multidisciplinary teams advance the body of knowledge, a key step in innovation. We have seen outcomes of new minimally invasive modalities and their ever-expanding utility and implementation. While interventional cardiologists may be able to provide care, it is the cardiac surgeons who are best positioned to offer a complementary spectrum across a multitude of modalities with clinical equipoise. The therapeutic interventions today will serve as disruptive technologies tomorrow. Will you be on board? I challenge all clinical pursuits to engage in both surgical and new modalities such as structural heart. I challenge all educational leaders to push the paradigms of training by accepting the traditional as well as the integrated. I challenge our leaders to eliminate gender disparities of our field from surgeon to surgeon, as well as just the same from provider to patient. I believe the TSRA Executive Committee has a privilege to serve, and I am humbled to be a volunteer member of this team. As TSRA endeavors to provide for trainees, we first focus on the pillars of education, community, research, and career advancement. We aim to create a body of work that provides selflessly and consistently in these principles. As a servant leader, I remain enthusiastic as I was back in 2016 when I first fell in love with this place and made this group my home. As a resident specialty, we will continue to evolve. It is my hope that objective demonstrations of our work continue to dictate and assist the training of the future of our field. We are to be continuously measured by our ability to innovate and to evolve, as these are the metrics which history rewards bountifully. As the complexities and technological advances continue, as collaborating specialties infringe, and as to exalt the alternative, our specialty must not go quietly into the night. As fundamental as the oxygen we breathe, we must innovate or expire. A non-traditional mindset is essential to novel perspectives and pursuits in cardiothoracic surgery. Thank you so much.
Claudine, thank you so much for your leadership and all of your hard work for the TSRA. Now I would like to introduce the winner of this year's Socrates Teaching Award. This award is given annually to an outstanding faculty member in our specialty in recognition for his or her commitment to resident education and mentorship. There were very many nominees this He is a master cardiac surgeon and a master educator. It is because of him that residents continue to be motivated and remain excited to work daily. When I started training in cardiac surgery, I was almost certain that I would fail. I had the impression that cardiac surgery was too technically challenging and that I was unlikely to possess the necessary talent to perform the high-risk operations. Dr. Tolis recognized this early, and after about 2 weeks of our time together, looked up from the field unprovoked and told me that I would succeed in this training program. He told me I had steady hands but lacked the confidence, and assured me that I could overcome this with mental discipline and planning. Dr. Tolis lifted a weight of despair off my shoulders and then proceeded to teach me to operate and care for our patients. I could not have gotten off the ground without his ability as an educator. I think that last letter writer really exemplified why we selected Dr. Tolis for this year's award. He really makes sure that he focuses on every single resident, regardless of where they are in their training program and how well they're doing. And we just want to thank you, Dr. Tolis, for your contributions that you've made to this specialty. We know that teaching is not an easy task. And now let me allow Dr. Tolis to say a few words of thanks.
I would like to thank the TSRA and the Society of Thoracic Surgeons for this great honor. An award that comes from a voting committee of trainees, not influenced by surgical administrators, is much more important than any other accolade or empty platitude coming from any other source. Surgical education has become a passion of mine, mainly stemming from multiple shortcomings that I encountered during my own training, which I promised not to repeat when I became an attending surgeon myself. I want to assure you that there were multiple big-name attending surgeons in the era when I trained, and by the way, there still are, who were lionized by the establishment but were scared of relinquishing any significant portion of an operation to a trainee, or just unwilling to inconvenience themselves. Many things have changed for the better since then, but many things have also changed for the worse. Regulations banning surgeons from overlapping non-critical portions of the operation have hurt our ability to provide our trainees with the autonomy we enjoyed as residents. The work hour restrictions for cardiac surgical trainees are nothing more than a non-realistic picture of what being a cardiac surgeon looks like, as well as a very poor simulation model of what your life will be like in the years to come. It should come as no surprise that early burnout and mental health issues among young surgeons are reaching epidemic proportions and are not successfully mitigated by the occasional appreciation lunch, chocolate chip cookie, or pin offered by the hospital. We need to look at surgical education with a dose of honesty and self-criticism if we are to help the next generation of surgeons master the operations that we learned from our own mentors. We need to stop pretending that educational activities which buff up our CVs and help us move up the academic ladder are actually geared towards surgical resident education. In the majority of U.S. medical schools, being a recognized surgical educator by your peers and trainees confers no access to a path for academic promotion. That needs to change, and I hope that our societies will be bold enough to tackle this third rail, even if that makes the educational establishment uncomfortable. Again, thank you very much for this tremendous honor. I hope I remain worthy of your trust in the years to come.
Thank you again, Dr. Tolis. Our next award is the Magoon Teaching Award, which goes out to a young faculty member in their early career who exemplifies dedication to resident education and mentorship. Now, we all know teaching is not an easy task, but to be able to do this as an early career is even harder. And so this award goes to a very special educator, Dr. Kaneko, who is from the Brigham and Women's Hospital. Again, there were so many letters that were sent in for Dr. Kaneko, and here are a few things that were said about him. He is a role model, a teacher, and a surgeon that countless residents and fellows wish to embody one day. He has high expectations and knows how to push residents in a way that allows them to realize their potential and rise to the level he presumes without highlighting the inexperience. He is the busiest surgeon at my institution, but never lets this affect our education. He expects residents to take charge and put them in the operative driver's seat. Every day he asks and expects you to perform more than the day before, and he knows how to appropriately force you out of your comfort zone a bit at a time. I don't want to speak for others, but residents will choose his room anytime given the chance. And we all know from experience that being chosen as the attending that all the residents want to operate with is probably one of the highest compliments you can receive. So thank you, Dr. Kaneko, and now let's go on to Dr. Kaneko's comments.
Wow, what a humbling honor to receive the Magoon Award for 2022. I really want to thank the TSRA and all the trainees that have supported me with this award. This definitely is the proudest award that I've ever received, and I almost feel bad for receiving the award for doing the things that I love to do. Nothing's more valuable than watching the progression of trainees being able to do the parts of surgery that they weren't able to do previously. This will certainly motivate me to train the future stars in our field, and I really thank you guys again for this honor.
Thank you again, Dr. Kaneko, for your contributions to our field. Our next two awardees are for the TSRA Traveling Fellowships. Each year, the TSRA awards a traveling observership within the U.S. to allow trainees to gain a unique perspective of cardiothoracic surgery and develop a mentoring relationship between the awardee and host faculty. This year, Dr. Natalia Bahatirovich is our U.S. Traveling Fellowship awardee. She is currently a trainee at UC Davis who will be at Stanford on a cardiac transplant experience. The TSRA also provides an annual Global Outreach Fellowship, and this allows a trainee to expand their training beyond U.S. borders while cultivating international relationships between faculty members and trainees. This year's Global Outreach Fellowship recipient is Dr. Benjamin Smoot. He is from the University of Pennsylvania, and he will have the opportunity to travel to Mexico to provide medical care for underserved children and teens. Here are some comments from Dr. Bahatirovich as well as Dr. Smoot.
Thank you so much for this honor and fantastic opportunity to enhance my education, my career development, mentorship network, as well as surgical skills. I remember reading book Kings of Hearts and was so inspired by Dr. Lily High's journey on looking for solutions to cardiopulmonary bypass machine by traveling across the country and visiting several institutions. I'm very grateful for an opportunity to have similar experience of learning about heart failure and transplantation in my case. I'd like to thank STS and TSRA for this award and opportunity. I would also like to thank my medical school mentors that have inspired me to join this fantastic community of cardiothoracic surgeons, Dr. Morris, Dr. Hiroshi, and many others. I would also like to thank my residency program and my program director, Dr. Raff, and all the cardiothoracic surgery faculty at UC Davis for their support in my education and career advancement. And special thank you to my host institution, Stanford, and Dr. Hissinger for their support as well. Thank you very much.
Thank you all very much. It's truly an honor and a privilege to be selected as a recipient of the 2022 TSRA STS Global Outreach Fellowship. Thank you for your generous support, which will provide me with the opportunity to travel with Dr. Dable and his team from Children's of Alabama to Chiapas, Mexico in 2022. Each year, Dr. Dable and his team collaborate with Heart Care International to provide free cardiac surgical care to underserved children in Latin America in an effort to develop sustainable cardiac care programs that will ultimately enable communities to care for individuals with congenital heart disease without perennial international assistance. As a graduate of UAB, Dr. Dable has been an unparalleled mentor of mine since my first days of medical school. Now in my third year of training as an integrated cardiac surgery resident at the University of Pennsylvania, I could not be more excited for this opportunity to once again work alongside him and under his mentorship. In particular, I look forward to gaining unique perspectives that will improve my understanding of how complex socioeconomic dynamics globally affect individuals who are born with congenital heart defects. I hope that my work with Dr. Dable and Heart Care International will allow me to establish longitudinal relationships and new skills that will enable me to continue working with others as my career progresses in order to develop and implement sustainable models of cardiac care that will improve global access to cardiothoracic surgery. Again, I cannot thank you enough for your generous support in this unparalleled opportunity. Thank you.
Before I leave you this evening, I just want to highlight a couple of updates just so that you guys are aware and some of the things that our staff have been working really hard to provide resources for. So we have Garrett, our secretary. Congratulations, Garrett. He recently matched at University of Pennsylvania, congenital heart surgery. He will be ushering in our new mobile application, which will host all of our resources in one area. So imagine our textbooks, our podcasts, all in one reachable area. We have David Blitzer of Columbia, who is our projects chair, who is currently managing all of our podcasts right now. We have greater than 800 subscribers, 135 entries, each of them having a clinical expert on all the topics of cardiothoracic surgery, not to mention ethics and additional topics as well. Also, he is currently reviewing additional questions. We're adding to and revamping our question bank, but we'll have greater than 800 questions, all peer-reviewed, and that will be coming out very soon. We have Fatima, our education chair from Johns Hopkins. She's been organizing our surveys and doing a great job with all things education. We have Jessica from the University of British Columbia, who organized this conference. So I want to thank her for that, as well as will be the new editor for our operative dictations, which is going to be the second edition that will be coming out a little bit later this year. We have Yihan, our vice president and right-hand woman. She's really, really great, really awesome. She is ushering in our TSRA Global, which is connecting the resident associations across the world and kind of putting us all in one opportunity to work together and do some great things. Last but not least, I just want to highlight that we've been working on, and that is our most recent TSRA third edition review text. As you can see, it is not small. It's larger than our clinical scenarios, and it's filled with a lot of great things that we're proud to have. Dr. Carpenter has signed off on it as the TSDA president, and we are moving forward with it. It will show up in Amazon within a week's time. I just want to thank everybody's patience and everybody's due diligence in helping us reach the different levels that we have this year. It's an awesome year, and congratulations to everyone, and happy socializing, TSRA Mixer. Thank you so much.
Thank you guys for allowing us to entertain you this evening. Admittedly, it's pretty interesting watching yourself speak on a video. But that concludes our portion prior to the actual social mixer. So please, the Remo platform allows you guys to go into all the different tables, have conversations. At some point, there'll be a randomization again, but feel free to leave that table and enjoy your own conversations amongst groups and colleagues that are here. I'll let Jessica speak on the Remo rules.
Yes, so please unmute your video and audio during the networking portion to maximize your networking. Table hop as you would like. You just double click on the seat or table that you would like to join. There is a maximum number of participants per table. So if it is full, then just keep an eye on the table as soon as it that you can jump into. There will be a shuffle, which will shuffle people up randomly at around 25 to 30 minutes in. And there is tables that are specifically for cardiac, thoracic, and congenital, or miscellaneous, and then just random tables as well for people to just sit and socialize. There is a help desk as well at the top right corner for you to move to that table. If you have any questions at all, just double click on that table and you'll go there. And if I see you there, then I'll move over there and help with any issues or matters that I can help with. Please be respectful of others and enjoy meeting and catching up with all your colleagues around the world. Congratulations to all award recipients. Congratulations to Dr. Lewis and your presidency, and look forward to catching up with you all soon.